Does a New Zealand funeral director's statement that 95% of the corpses he sees had been vaccinated against COVID-19 prove that vaccines are causing mass death? No, that's not true. This claim was drawn from anecdotal observations that did not account for consequential variables, nor were these observations independently confirmed or corroborated by published or official data. With more than 80% of New Zealand's population vaccinated against COVID, deaths of vaccinated persons would be a common coincidence. Lead Stories further determined that at the time of publication, the man in the video is not affiliated with either of New Zealand's professional organisations that represent funeral homes and their directors. The claim originated in a video published to the open-source video-sharing website Odyssey on September 26, 2022, by the account New Zealand Doctors Speaking Out with Science. A shorter clip was published the following day, which we have. Brenton Faithfull, a self-described 41-year funeral director from New Zealand, was interviewed by a person identifying himself as Dr. Matt Shelton, but who opened the video with a caveat that he was not speaking with any medical authority or providing medical advice. New Zealand's Registry of Doctors lists only one Matt Shelton, whose certificate to practice was suspended by the Medical Council of New Zealand in 2021 for spreading anti-vaccine messages. Below is a screenshot of the video as it appeared at the time of writing. Source: Odyssey. Screenshot taken on Wednesday, October 26, 22 hours 49 minutes and 22 seconds 2022 UTC. On October 20, 2022, The Epoch Times published claims made in the Odyssey video in an article, titled, 95% of corpses had received COVID vaccination within 2 weeks of death, funeral director. The article read, in part, quote, a funeral director from New Zealand says that 95% of the corpses he has been seeing had received a COVID-19 vaccine within 2 weeks of their passing away. End quote. At the time of this publication, it appeared that the Epoch Times had removed its original story. Below is a screenshot of how it appeared on October 24, 2022. Source: Epoch Times. Screenshot taken on Monday, October 24, 12:03. 45:2022 UTC. Lead Stories transcribed a portion of the 43-minute interview with funeral director Faithfull below, which was also included in the Epoch Times reporting. Quote, 95% of the people who have passed away through the work that I've done have been vaccinated within 2 weeks. It's very obvious. They die within 2 weeks of receiving the vaccination. A lot of them almost appear to have died from anaphylaxis, almost a reaction straight away to the booster. They die the same day, the following day after receiving the COVID-19 vaccination. This isn't a one-off case. This is the majority of cases that have come through our facility as well. It's not a question we would normally ask the families. End quote. Faithfull added that vaccine records are private information, and often that information has been freely given to us, which Epoch Times omitted from its reporting. Our World in Numbers, an Oxford University online library of statistical data, published a chart of official reports that showed nearly 85% of New Zealanders have had at least one COVID vaccination. The average age at death in New Zealand is 82, and almost 98% of New Zealanders in that age demographic are vaccinated against COVID, reported New Zealand's Ministry of Health. As such, there is a high likelihood that a majority of those who have been recently deceased in New Zealand are elderly and vaccinated, a coincidence that does not prove causation. In its article, Epoch Times used the interview with Faithfull to suggest that funeral directors, including those in the United States and the United Kingdom, have found that COVID vaccinations are causing higher death rates. In an email sent to Lead Stories on October 26, 2022, Dr. Joe Bourne, Chief Medical Officer of the New Zealand Ministry of Health, said the following, quote, without knowing exactly what other information or analysis has been used by the presenter to reach his conclusions, the Ministry of Health is unable to confirm the veracity of the video. However, the video appears consistent with many others of this type that we have seen emerge from unofficial sources throughout the vaccination program, which offer alternate interpretations or theories about the effects of vaccination on illness and mortality. The ministry uses a rigorous process to compile and verify information regarding the COVID-19 outbreak and to support the vaccination rollout. This involves drawing a complex range of information from a variety of sources to determine infection and transmission rates, as well as gauge vaccine effectiveness.